Welcome back. It's the end of an era at the Vermont Department of Health. Dr. Mark Levine retired as the state health commissioner at the beginning of this month. I sat down with him to talk about these past 8 years as Levine retires as one of the longest serving commissioners in Governor Scott's administration. Dr. Levine, thank you so much for being with us today.
Oh, it's my pleasure.
So congratulations. Congratulations on your retirement. Congratulations on everything you've accomplished. How are you feeling wrapping up your years at DOH?
Well, it is a little bit of a surreal feeling at this point in time. As you know, on the national and local scene, public health never lets up. There's always stuff going on. There's a lot to keep me occupied and busy still. So it hasn't fully sunk in, to be honest, although people are beginning to celebrate. And because of that, my participation in those activities, I'm kind of getting the message that, yep, just a few more days. Starting to think about packing up the office and all of that.
What would you tell yourself 8 years ago when you were first stepping into this position? What's the advice you would have for you then?
Yeah, 8 years ago, I was like, gee, this is a whole new ballgame for me. I'm moving from a world of taking care of patients one-on-one and a practice of my own to a population health perspective, where I'm really dealing with very big public health issues on a statewide basis, and I suddenly have over 600,000 patients. And so I was like, I need to learn a lot. I need to really come up to speed. And that happened because I have an excellent staff at the Department of Health, lots of subject matter experts in lots of areas, not all the areas that I went to medical school for, and I learned a lot. But never in my wildest dreams would I have anticipated becoming a sort of media star and talking to Vermonters many times per week in the midst of a once-in-a-100-year pandemic.
Talk to me about COVID-19 and what that was like having to navigate a global pandemic here in Vermont.
Yeah, well, I'll tell you, it was a lot better navigating here in Vermont than in many other places, because we have wonderful citizens of our state who actually are very community-minded, civic-minded. We're the home of town meeting day, and they took our guidance and really took it to heart and implemented it, and we turned out to have one of the best responses that the country has had, and certainly the lowest death rate from COVID in the continental U.S. So that aspect of it was very, very gratifying to deal with Vermonters. But of course, we were dealing with a totally new, as we call it, pathogen, something that could infect us that hadn't infected humans before. So there was so much unknown and so much that we had to learn on the fly. People often talk about building the airplane as you're flying it. And in some ways, COVID was like that because there was nothing known in the beginning. We had some playbooks from 100 years ago, influenza pandemic and things of that sort. And we knew it was a virus that spread by respiratory means. But besides that, we had a long way to go in terms of testing, in terms of vaccination, all of those things that people now take for granted. But way back when, there was a lot of unknown. There were a lot of losses people felt, some directly from human life loss, some from just time at their work, kids' time in school and the kinds of achievement they might have had there not been a pandemic, and people having to live with more restrictions in their life, at least for parts of that time, than we'd ever asked them to do before.
And I want to talk about the Agency of Health and Human Services because we've covered a lot of the job cuts and the funding that will be cut. And we do know that millions of dollars of cuts in COVID funding, at least for the state of Vermont, will impact some parts of DOH. What do you say to people who are watching this, who may be worried about how this could impact them?
Well, public health is under a bit of assault right now, and it is a very challenging time. I'm heartened to say that the recent cuts that we've been hearing about are impacting us, but not to a very huge degree. Partially that's because many of the grants were due to expire within several months anyways. If we had the opportunity, we would have done this in a much more humane and respectful way rather than an abrupt way. But they do influence community partners that we work with, who we sub-grant to, and they do influence some of our workforce. Fortunately, most of them, as I said, will not be heavily impacted, but the areas that nationally you'll see the impact in would be in epidemiology capacity, laboratory capacity, and these are things that are very fundamental to just fighting the next infectious disease that emerges that we need to pay attention to. The structure of public health in terms of its workforce and data monetization and infrastructure. And then, dare I say the word equity, but really dealing with those disparities that we see in different populations. Vermont's a very healthy place, but knowing it's healthy doesn't mean every Vermonter shares in that good health. And when you start to really look at our data, you find there are groups of people out there that don't share in the same health as the average Vermonter might. So equity was impacted by those grants, and immunization as well. More recently, there's been another rescission of a grant dealing with environmental justice from the DEA. So we're kind of looking towards the future, never knowing exactly what might happen next.
What are your thoughts on Robert F. Kennedy Jr. leading the Agency of Health and Human Services?
Well, I'm trying to give him a chance because, the words that you hear sometimes are very consonant with public health, like chronic disease being the most expensive part of our healthcare budget. It's really about 80 cents on the dollar, and anything to prevent chronic disease would be a good thing. I want to make sure, though, that the chronic disease prevention occurs in ways that we know are evidence-based and data and science-based, and I'm not hearing that 100% yet. I also want to make sure that we don't fight chronic disease and sacrifice numerous other initiatives that are still very fundamental to public health. Things we call foundational public health, like emergency preparedness, pandemic preparedness, like environmental pathogens and preventing harm to people from them. It's not all fighting chronic disease. There are so many other things that are important to us. And yesterday we did hear about thousands and thousands of positions abruptly cut for CDC, for FDA. Some of these things are very concerning to me. Some of the FDA positions, we're talking about the agency that deals with vaccines and immunizations and authorizing those vaccines, new drugs, the food supply safety, very important. From CDC, most of the federal funding that comes to state health departments comes through the CDC. And there are areas like, again, injury prevention, whether that be from overdoses or suicide, factors that actually account for the majority of deaths in those under age 50. We always hear about chronic disease, but in under age 50, it's really injury prevention that would be most important. And included in there, besides the things I mentioned, would be gun violence and firearm safety as well. So there are going to be a number of impacts that we don't even understand yet because there wasn't a lot of transparency yesterday. We're just starting to hear about where in the CDC some of these cuts occurred and what may or may not happen to the programs. We're really not aware yet.
As you leave the Vermont Department of Health, what is your hope for DOH?
Well, it's a very successful department. It's done so much good work, and most of the good work, I'd like to say, is under the radar because public health usually is not front and center, like in the middle of a COVID pandemic. We're usually doing all of the work we do when people don't even know that it's happening, and that's fine. My wishes for the Department of Health would be that the federal fund streams that we do get continue to come to us. If they're a little less, fine, but if major programs are cut, not so fine. because states all rely on this money to do the fundamentals of public health. As I said, chronic disease prevention, injury prevention, pandemic and natural disaster preparedness, environmental health, initiatives in both ends of life, maternal child health, where we want every newborn to have a great opportunity to be healthy and enjoy a great life, as well as their parents. And then at the other end of life, especially in a demographically challenged state like Vermont now, in terms of our aging population, to have healthy aging. And that would be really, really important initiative. And then to be able to deal with the challenges that are coming our way every day. Climate change is by many regarded to be the #1 public health emergency of our time. And we need to be able to have good public health programs in place to help us adapt to the climate that we are confronted with. We're not talking about the prevention programs that are going on across all states, ours especially, but we're talking about just basic public health programs to make sure that the impacts of floods, the impacts of heat, extraordinary heat events, the impacts of vector-borne disease, all these things that are happening now with an evolving climate that our Vermont citizens can do well with.
What's next for you, Dr. Levine?
Well, there's going to be a period of less ambition and just some relaxation and rest. But down the road, I do see myself wanting to contribute in some way, again, to public health. Perhaps in a less intense position, in a more focused way, but there are so many opportunities to contribute to the state of public health. And in my case, one of my passions is to better integrate the healthcare system and clinical medicine, primary care, with public health. Because many developed countries around the world have learned how to do that well, and it improves the health status of everybody in the state.
I'm positive this is not the last time we'll see or hear from you, but thank you so much for all of your work. Thank you for all you've done for the state of Vermont.
Well, thank you, and thanks for inviting me in.